and welcome to Buffalo. I'm Heather Torito, the Program Director for the Pediatric Emergency Fellowship here in Buffalo, New York. The goal of our program is to provide fellows with the tools they need to be prepared for and excel in pediatric emergency medicine. Our training is centered in the recently opened John R. Oshai Children's Hospital here on the Buffalo Niagara Medical Campus. There are many aspects to our fellowship program that make it an outstanding place to train. We have enthusiastic and dynamic faculty who are invested in the training of our fellows. Our clinical experience is second to none. Our ED is the only pediatric facility in Western New York. Fellows have the opportunity to diagnose and manage a full range of pediatric complaints, from bread and butter pediatrics to very rare conditions and diseases. We have a solid research infrastructure with supporting faculty for fellow scholarly activity. Our program provides fellows with an organized, comprehensive curriculum. We provide fellows with a framework to absorb essential medical knowledge, along with ample protected time to read, study, and review. Our fellows also participate in multiple simulation and skill labs to practice important pen procedures. And as our fellows progress through fellowship, they have a gradual and stepwise progression to the supervisory role, with increasing pretending shifts as they progress through fellowship. Let's not forget, Buffalo is a great place to live and train. It's a city alive with sports, restaurants, theater, and cultural events. Thanks for visiting.
My name is Jeremy Killian, one of the pediatric emergency medicine physicians. I'd just like to give you a little overview of the ER. Our pediatric ER sees roughly 48,000 visits a year, and we see up to age 21. We are the region's primary referral center, seeing patients from the end of Ontario all the way into Pennsylvania. We use the Cerner EMR platform, using FirstNet as a tracking board and to do your documentation. Patients are signed in acuity and seen based on how sick they are. We have almost every pediatric subspecialist available, with the exception of cardiothoracic surgery, and that is hopefully coming within the year. So if you're interested in Buffalo and interested in pediatric emergency medicine, this is a great place.
Hi, my name is Marianne Borski. I'm one of the pediatric emergency medicine attendings, and one of my jobs here is to do ultrasound. During my fellowship, I really like doing ultrasound, and so now I am the director for our division. We have two ultrasounds here. One is the TE7, that's a mine ray. I'm hoping by the time September comes next year that we will be hooked up to QPATH. It's on the plan now. Buffalo General next door has it, and ECMC as well, so we should be next on board with that. Our oldie but a goodie, our Sonos site here, stays in our trauma room. It's really great for fast exams and basic imaging. It's about 8 years old, but it works really well, and so we use that as well. But the TE7 is pretty easy. It's used like an iPad, basically. A lot of touchscreen opportunity there, and we will teach you how to use this. We understand that most pediatric residents come out of residency without having a lot of ultrasound knowledge. So in your first month as fellowship, you will take the Introduction to Ultrasound course, which is usually a 2-day course, and you go over all the major types of exams on actual models, so you have a good sense of how to do ultrasounds. And then in your first year, you will do a month of ultrasound. We coordinate this with the emergency medicine docs next door, who are amazing. They're wonderful to work with. They have multiple residents during the month, so they have multiple attendings who you can scan with. So you get a lot of basic anatomy out of your way. You figure it out, and then coming here as well, working with me, doing some scan shifts. During that month, you do about 250 scans, which most people have no problem doing, in a variety, trying to hit all the ASAP requirements. And then throughout your 3 years, we ask you to do a minimum of 500, I think.
Hi, my name is Jill Pinnell. I'm one of the new PEM attendings. I'm a recent graduate from here at UB. Here at UB, our fellows are given multiple teaching opportunities. They participate in PEM Corps, which is a monthly comprehensive lecture series provided by the PEM Fellows for the emergency medicine residents. This includes pediatric sim cases and scenarios led by the fellows. Each year, they also help teach the EM residents pediatric airways during the difficult airway course. They also teach pediatric residents during their procedure module. This is hands-on training for multiple procedures, including splints, LPs, lacerations, IO lines, intubations, and many more. There are also many teaching opportunities, including other lectures, as well as precepting students and residents during their PEM rotations.
Hi, I'm Dr. Cross. I'm one of the attendings here in the emergency department, and I help with a lot of the education and the research. We have a lot of research opportunities here for both clinical and bedside research. We're part of the Buffalo Niagara campus and the University of Buffalo here across a whole variety of divisions and departments, and we can coordinate lots of different research opportunities depending on what you're interested in. We do a lot of work to teach research methodology, to teach how to do quality improvement studies and quality improvement work as well. Recent fellow studies have included things like looking at how to diagnose and treat appendicitis, and ultrasound studies and other things of that sort of interest, in addition to a variety of quality improvement projects. We also have a very robust journal club. Doesn't sound like something you'd usually advertise, but ours is a lot of fun. It's both social. We do it at rotating faculty members' homes. People often bring kids and significant others. And then there's often a prepared journal article and robust discussion about whether we agree with what's going on in that and should we bring that into our own ER.
So I'm going to talk to you about our trauma program. We are a level 1 ACS verified trauma center and one of only 6 in New York State. On average, we see approximately 9,000 injured patients every year. Of that, over 30 level 1 trauma activations and over 100 level 2 activations, with approximately 400 kids admitted throughout the trauma process. Our trauma team consists of our trauma surgeons, who are pediatric surgery trained, our ER physicians, as well as collaboration with our pediatric ICU, anesthesia, as well as support services, including respiratory therapy, imaging, and others. We perform in monthly mock traumas with our trauma team to ensure quality and good patient care. And this is a collaborative process that's ongoing.
I'm Marian Borski again, now with my transport gear on. I'm also the ultrasound director, so we're just going to go over transport today. My job is to give medical direction for the most part to some really awesome critical care nurses who are on our transport team. There's 6 of them, as well as some really great respiratory therapists who transport patients all over Western New York. Now, some people don't know what Western New York means, so I have a map here. This is Buffalo here. This, way over here, is New York City. So you have Lake Erie is our eastern border, Lake Ontario is our northern border, and then Pennsylvania. However, for Western New York, we cover a pretty large area traveling to pick up kids and actually taking them to different places. So here we are in Buffalo, all of this area through here, almost to Rochester, down into the Allegheny area, into as far as Coudersport and Bradford. So we have a pretty large area that we travel, and there's hospitals all over, but there's no one who's comfortable taking care of pediatric patients. So we have a ton of transports. One year we had as many as 900. This year we're probably going to hit about 700 because of COVID. So we do a variety of transports on ambulance. We use one of the local ambulance companies, and then we also fly with Mercy Flight, which is our air transport. Mercy Flight has a fixed wing as well as a couple helicopters. You will be able to travel on all sorts of different ways as a fellow. We do recommend that the stat team brings a doc if there's somebody who's peri-arrest or post-arrest or just really ill. So those are the kinds of kids that you're going to go for. They're usually pretty sick. We've had some good stories from some of the fellows doing some emergent ultrasounds in another facility to try and diagnose problems. During that time, you will learn Mercy Flight. You'll get some Mercy Flight training, so you'll feel comfortable being on a helicopter. And you'll work pretty closely with all of the stat nurses as they come down and help with traumas and also go do rapid responses on the floor and in the PICU.
Welcome